The COVID-19 pandemic and lockdown has brought a sense of fear and anxiety all around the globe. The virus has led to short-term as well as long-term psychological and mental health implications for children and adolescents.
With many clueless and worried parents, it is crucial to know how to evaluate and develop strategies to stop psychological health disorders from getting worse. Reporter Reagan Hill has more.
Thanks, Abby. With COVID-19 still ongoing, people are getting very tired of isolation and restricted social activities. To some, this is causing effects such as stress, anxiety, and episodes of depressive reactions. According to the CDC, suicide rates have increased by 11% since the start of the pandemic in January, and it is imperative to ensure that these health issues don't further increase into a psychological illness. I spoke with Shannon Henderson, a licensed specialist in school psychology, to learn more.
So I think it's important to try to keep yourself healthy, number one, physically healthy. Like be sure you eat, healthy foods, make sure that you're not, I know during a pandemic, it's easy to kind of escape into some of those unhealthy behaviors like unhealthy eating or drug or alcohol use. It's really important to try to avoid those things. Also getting enough sleep is important, but maybe doing some things like just making a point to take some time to relax.
Looking at the 2020 Stress in America survey conducted by the American Psychological Association, 52% of 13 to 17-year-olds said that they had less motivation to do schoolwork, and 43% said that their stress level had increased.
I just have got out of contact with a lot of people. I gained weight, and that just brought everything down. The online school thing has just been very stressful, not having people to directly talk to.
Depression kind of caught up with me a little bit, only because I was mostly focused on making others happy and like making sure they were okay, that I kind of forgot to make sure I was okay and that I was like being fine. And so I kind of started hiding that from myself, like by distracting myself with school.
With many teens struggling to find psychological help, it's best to let people know how you are feeling and reach out to others so they can help you find the resources you need.
I would say really be mindful of how you're feeling, and if you feel like you're seeing a difference or a change than where you were 6 months ago, 9 months ago, reach out to someone either at your school that's a mental health professional, like your school counselors, and they can connect you to the right person to get you some help. They can provide referrals to outside resources. If you're already in therapy, continue those therapy appointments, but just let people know how you're feeling.
If you are thinking about suicide, are worried about a friend or a loved one, or would like emotional support, the National Suicide Hotline Prevention number is listed below. Ella, Abby, back to you guys.
Thanks, Reagan. I agree. It's definitely been a tough year for everyone.
That's right. Just remember to be aware of what you're feeling and communicating and trying to stay in touch with family and friends.